Hey, Jason.
We're live now. Hang on.
I'm clicking out you then.
Did everybody make it back?
I'm back.
Gary, was there anyone else from your office that was on before?
Yeah, I'll check real quick there. Let me look. It looks like.
I can give him a second if you need.
He's getting on, Jason. I needed to forward him that link. I only got.
Okay, I'll give him just a second. We are streaming live to Sweetwater County Government YouTube page and the Sweetwater County Public Health Facebook page. I apologize to those folks out there. I had some technical difficulties with the live stream. I had to restart the whole thing. So we're just waiting for a couple members of the media to join our Zoom here, and we'll get started. Okay, I think that's probably everybody. Good afternoon, everyone. We've been at this for a few months now, but for those of you of the public who don't know me, I'm Deputy Jason Maurer. I work for the Sheriff's Office. I'm public information for the Sheriff's Office. Also served as the Chief Information Officer for the Emergency Operations Center, and I'm now moonlighting as the Interim Public Information Officer for Sweetwater County Public Health. As I mentioned, this is a Zoom meeting format that allows members of our local media to join on and interact with us. And also it's simultaneously live streamed over the internet to both the Sweetwater County Public Health Facebook page and also the Sweetwater County Government YouTube channel to allow members of the public to tune in and see what we have to say. As we discussed, we've worked really hard, and we have felt that it's really important that people continue to listen to us as we navigate through this virus. We've backed off on the quantity of releases in the hopes that when we announce that we're going to do something, whether it's a traditional print release or a live press briefing in this format, that people notice that it's probably important and we have something to say. So with that, by way of updates, we have now had, I have with me today Southwest Counseling Director Linda Aker and also County Health Officer Dr. Jean Station. And I'll just start by saying in the last 24 hours, we have 3 new confirmed positive COVID cases in Sweetwater County. That makes 10 in the last 9 days. For those of you who are keeping track, that brings our county's total to 35 with 12 active and 23 now fully recovered. Basically, since the softening of restrictions on May 1st, we've recorded 25 total positive cases compared to 11 during the lockdown, for lack of a better term. To date, we've had 3 patients who have been hospitalized. Each was treated and released. And thankfully, we've had no county residents who have died from complications related to the virus. With that, and really the reason we wanted to bring everyone together today is one of the lab confirmed positives, one of the 3 in the last 24 hours, happens to be an employee of Southwest Counseling. Southwest Counseling and Public Health have identified other employees and clients of Southwest Counseling who have potentially been also exposed. So one of the things that we wanted to communicate was for those people as Southwest Counseling is reaching out to those people and to their employees and clients. And then additionally, Public Health through contact tracing will contact you if you are identified as a close contact of their lab confirmed positive. The other thing, and I think Ms. Aker will speak to this, there's no reason to believe that any of the residential treatment areas or programs at Southwest Counseling have been exposed or affected. And that's probably enough from me at this point, unless there's any questions before I turn it over to Ms. Aker or Dr. Station. Linda, do you want to go ahead and start?
Yes. Good afternoon, everyone. My name's Linda Aker, and I am the Director of Southwest Counseling Service. And I was notified last night that we did have a positive COVID case at Southwest Counseling, and immediately started the ball rolling to assure that the safety and health of our clients as well as our staff were going to be taken care of. This individual was at work on Monday and Tuesday and was able to see 7 clients, which we're very fortunate because most of the clinicians would have a caseload much larger than that. So immediately those 7 clients have been contacted or are in contact with Southwest Counseling to notify them of the potential exposure to a COVID individual. In addition to that, we have had to quarantine or self-quarantine 7 of our employees at the College Hill facility. It's really important, though, that the public know this. It only is impacting the College Hill facility. It doesn't impact the other facilities of Southwest Counseling or other residential programs. So with that, I think we've handled the situation as best we can. For the clinicians that are impacted by being in self-quarantine, they will resume doing their clinical work on telehealth. So the clients will not be coming into the building. They will be seen through the Zoom. And I think today we had good conversations with Dr. Stations. We are in the process that the entire building was disinfected last night. It's being disinfected again today. So we're asking for all our clients to wear a mask coming into Southwest Counseling. If they don't have a mask available to them, we will provide them one. It's important to keep the distancing of the 6 feet. And more importantly, please do not go to work sick or come in if you're a client of Southwest Counseling if you're not feeling well. I think that message has to be clearly out there to people to protect all of us.
Thank you, Linda. Are there any questions for Ms. Aker? Okay, hearing none. Dr. Station, did you go ahead?
Jason. Well,
Yeah.
and I might, Dr. Station might be able to follow up on this as well. Not necessarily a question for Linda, but Linda, I think the way you're handling it is great. And I guess my question would be, a few weeks ago when we had report that an employee at a local shopping center was infected, it was handled extremely different, and I'm curious why.
Well, I think Dr. Station can speak to that as well, but I think we have enough experience under our belt at this point that sometimes that information, if it comes back to a private business, where public health is kind of between a rock and a hard spot in a lot of cases. If you have a private business owner that, or even a patient who doesn't want to disclose that, then.
Sure. But as public health, I mean, Southwest Counseling is a very controlled environment where a shopping center is not. So I guess, again, I'm just curious. Maybe Dr. Station can give us some insight on that.
All right, if we're talking about the same shopping center that I think you are, we offered to them what we're doing right now with Jason to do a press release and question and answer and discuss things. But we did not, and don't force that on people. And it was their choice not to do so. Again, I'm thinking we're talking about the same place. I mean, I don't know. If you're saying shopping, I only know of one shopping facility.
Yeah, I didn't want to call it out by name.
Yeah, no. And it was offered and it wasn't taken up on.
Okay, thank you.
Yeah, not for us not reaching out and offering.
And I think Dr. Station can correct me if I'm wrong, Gary. I think one thing that has changed, and this is just today. I mean, you guys have heard me. A lot of you have been dealing with me, not just in this role, but with the sheriff's office for a long time. And I'm always preaching about the importance of, as government employees, to be as transparent as we possibly can. I think one sort of boost in the shoulder that we received, and I hope I'm not overstepping, is some clarification from Dr. Harris, the state health officer, this morning in conversations with Dr. Station and Public Health Director Kim Lineberger, that potentially where a lab confirmed positive works is not subject to HIPAA necessarily. Dr. Station, can you speak to that?
We're not divulging names, but if it has an impact or to say, yeah, I mean, she's just saying be careful in terms of what, but this particular business that I think you're talking about, Gary, no, they did not want to come forward that way. So since there was only one case from there and we tracked nothing more after that at that particular time, we didn't push the issue further, but we offered.
Okay.
And,
so
regarding
you still
today
did track
with
then.
Southwest Counseling, and Linda thought too, there's going to be rumors, people will have concerns and fears, and it's better to get one statement out now and let them know what area it involves, that it's, one individual, what they are doing to contain it, and to reassure people, particularly family members who might have someone in residential care who would be concerned, and to alleviate their concerns and let them know what's going on, and being like Jason used the word transparent right off the bat. I mean, it's no surprise COVID-19 is in our community. We've lifted restrictions. We expected to see cases now. And the important thing is when businesses or facilities work with us, and if it's an identified, you're not afraid of what it means for you or your business or your establishment, but you come forward with trying to protect yourself, your clients, and the community, and know that it could be any of us. And the important thing is identifying people through testing and case contact tracing right away so there's no further spread. Like for every one individual we know about, we go anywhere from 3 to probably 20 people that we do contact tracing and in contact, depending on, where folks have been and who. What you're considered is from the day you develop symptoms, 2 days prior, when you didn't even have symptoms, you could have exposed anybody from that time on to until you recover. And symptoms initially are not very dramatic. People might just think they have allergies or the sniffles and just, blow it off. So like we've said, stay home if you're sick. Well, sometimes it's a fine line what is sick. Other times are more obvious than not. But the important thing is whether you're working, well, whatever you do, restaurant work, healthcare work, the mines, if you think you're ill, don't go in, notify someone and protect those around you. And I know when we talk to some of the mines and those businesses, they almost go a step beyond what we do to have people stay home. So I think it's just everybody trying to be responsible and respectful of each other, and knowing that we're very unrestricted in our county and in our state. And along with that goes responsibility. Look out and take care of yourself and others. So, I mean, wear the masks when you can, social distance, face coverings when you can't, or if you choose to do it in addition to. And importantly, like Linda brought up, stay home if you're ill. And I mean, I've looked at every day. I check the Wyoming Department of Health dashboards. You can go to the Wyoming Department of Health site and go to the COVID-19, and then they have the list of positives through listed by county. But on the left column, you can do a dashboard, and it'll show how many are recovered, how many are recent. And I always like to count because I figured Sweetwater County has the 4th populous county in the state. So we rank right now, at least as of yesterday, 8th in number of cases. So I'll think, well, that's pretty good. There are counties with far less people than us with more cases. And I think it can change in a heartbeat like it did in Uintah County. But I'm hoping that in our county, we're all trying to be careful and respectful of each other, and we can stay down the list on numbers of cases per capita. And we're all pretty familiar with what's happening in Uintah. I mean, they went from like 20 cases to 87 in a matter of 2 weeks. And it can be traced to a non-social distanced, dancing in a bar situation. And now they've gone from a containable 20 to they've tracked down 60 some people that are positive. And I think we just want to be careful and look out for each other in our county. Makes it a lot easier for public health.
Thank you, Dr. Station.
Mhm.
Other questions? I think that just to reiterate, we're all really tired of hearing about this virus. Public health's tired of it as well. I think that we have seen enough cases locally where transmission is due to someone who is ill or not feeling well, and then they go to work or they go to a public gathering. So I think that point stands. Both Dr. Station has mentioned it, and so did Linda. But other than that, we're not trying to exaggerate the danger. We don't expect people to lock themselves in their houses and avoid all contact with other people. We recognize that everyone's situation is different. And I think the best thing that we can do is, to take the personal responsibility to weigh the risk versus the reward of whatever activity you're looking at participating in. And I think right now, the safest types of activities are outdoors and in, small groups who you basically know, where they've been and who they've been in contact with.
Like Jason said, we're tired of it, but it's not going away just because we don't like it around anymore.
The only last item I would say is if any of our clients have concerns or want to talk to us, just give us a call at the 352-6680. We will be more than happy to discuss it with them, because many of the people that come into Southwest Counseling are already anxious and they're concerned about what's going on. So we want to be able to address those with those individuals. But we're doing everything possible to protect the public, our clients, and the employees of Southwest Counseling.
And thank you for that, Linda. And also on the same note, testing is readily available in our county. We're fortunate. Castle Rock does testing. I know at the hospital, you can drive through at the front 7 a.m. to 7 p.m. Monday through Friday, and 9 to 2 on weekends. And no questions asked. You can just get swabbed if you have any concerns. It's not hard to get tested in Sweetwater County right now.
And just to dovetail on what Linda said, and I think I said it at the beginning, but I was probably flustered because of the technical difficulties. But for any clients of Southwest Counseling, just rest assured that also you can contact, as Linda mentioned, you can contact Southwest Counseling if you're worried about it. But rest assured that if you are identified through contact tracing as a close contact of the lab confirmed positive, not only will you likely be already contacted by Southwest Counseling, but you will also be notified by public health through their contact tracing efforts. So.
Right. Anybody affected is probably notified by this time, but yeah.
So that's what we have for updates for today. Are there any last questions? Well, I appreciate everybody's time and patience. You're a good group to work with, as always. Thank you. And we'll continue to be
Thank you, Jason. Thank you for
Dr.
putting this together. We appreciate it.
Yep, we'll certainly be in touch, and I hope everyone, stay safe, stay healthy, and don't forget to laugh about it. Thank you.
Thank you.
Thanks all.
Bye.
Bye-bye.